Hi, everyone, and welcome to the Colorado State University Prevention Extension Cast. I'm Dr. Nathaniel Riggs, and I'm the Executive Director of the CSU Prevention Research Center. And I'm hosting the Prevention Extension Cast from my office here at Colorado State University's main campus. I'm happy to be joined by Heidi Williams. Heidi's the Director of Colorado's Opioid Response for the Colorado Attorney General. And we're going to be talking about Colorado's approach to distributing the state's opioid settlement funds. But first, I'd like to introduce our speaker. Heidi Williams is a Colorado native and grew up in Brighton, Colorado. She and her husband, Toby, married in 2001 and have 3 children, Michael, Chloe, and Noah. She graduated summa cum laude with a bachelor's degree in political science in 2017 and earned her master's in public administration from CU Denver in 2018. And she's also the former mayor of Thornton. She is passionate about finding solutions for Coloradoans who have been impacted by the opioid epidemic and feels honored to be in her current role. And we are honored to have her here to discuss Colorado's vision for the distribution of opioid settlement funds. And I'm especially honored because this is the second time this week that I've been able to talk with Heidi. Heidi and her team at the AG's office led a very productive and informative Colorado Opioid Abatement Conference that included presentations on best practices for addressing the opioid crisis, the nuts and bolts of opioid settlement funds, how to leverage state and national resources, and practical information about receiving funds. So a lot of the things that we're going to be talking about today. So I guess we're kind of returning the favor and getting the word out on how the opioid settlement funds can be distributed and for what purposes. Now, for those of you who have yet to join us for a Prevention Extension Cast, I'll be moderating a 45-minute Q&A with Heidi about Colorado's approach to the distribution of the settlement funds. And then we'll have some time for our guests to respond to any questions that emerge from the audience. So throughout our conversation here today, please feel free to enter those questions into the Teams live chat. You can find the chat button, at least on my screen, it's on the upper right-hand corner there. And please, enter those questions and I'll relay them to Heidi at the end of the cast. So as always, I'd also like to thank USDA and the National Institute of Food and Agriculture for providing funding to support the Prevention Extension Cast. All right, so let's get started. Heidi, before we discuss the more technical aspects of the applications for funds, would you mind giving our audience a general overview of what the Attorney General's office of the Attorney General's office and its role in substance use mitigation?
Yeah, sure, I'm happy to, and thanks for having me. One of the things I think that's interesting is a lot of folks don't really know what the Attorney General's office does. And so I love that you asked me that question. So our office is basically there to, protect Coloradans, especially the Consumer Protection Office, which I work directly with. Our Consumer Protection Office actually goes after bad actors who are, in some way, shape, or form violating the Consumer Protection Act. So as far as the opioid settlements, the way we got involved is the Attorney General has sued, along with many other states, it's a multi-state lawsuit, has sued the actors who basically started and are continuing the opioid crisis. So most people are probably familiar with Purdue Pharma, and the Sackler family. If you haven't watched Dope Sick, that'll on Hulu, that will give you a really good idea of what the Purdue family, or I'm sorry, the Purdue Pharma and Sackler family had to do with the opioid crisis. We've also sued and settled with Johnson & Johnson, 3 large drug distributors. We just announced a couple of other settlements that are, finalizing soon. And so what happened was the Attorney General, Phil Weiser, he decided in his first year that he needed to hire somebody to really work with our local governments and our regions to figure out what they need to do at the local level to really abate the opioid crisis. And so we came up with a memorandum of understanding with our local governments, which created some different to distribute like settlement funds to the local governments rather than the state taking control of all of those, because we know that different parts of our state have been affected differently by the opioid crisis. And so they're going to know way better than we do what they need to do in their communities.
Sorry, my bad. It's been 2 years since we've been using Teams, and I'm still forgetting to unmute myself. So we'll try that one again. Apologies. Thanks for that context, Heidi. It's really helpful. And I guess broadly, how does the AG's office view the problem of opioid use? In particular, what are considered the most important causes and consequences of opioid misuse from the AG's perspective? And I know that we'll talk about how the proposals are going to be going in to at the regional level, but this might help our audience of community members who may be applying for these funds better understand kind of the approaches that you feel would most align with your perspective.
Yeah, for sure. So there are what we call our allowable uses. You can find those on our website, coag.gov/opioids. The allowable uses were basically negotiated by the attorneys who are working on these settlements and, have committed to these defendants that we will, spend the money on these allowable uses. So you've got several buckets. You've got treatment, recovery, harm reduction, law enforcement, prevention and education, which obviously is right along the lines of what you all are working on. And so those are basically the buckets. And a little bit later in my slideshow, I can show some of those uses and what those look like.
Thank you. Now, can you tell us or tell our audience what the AG office's current plans are for using those funds?
Sure, and I'm going to advance my slides here. So just as a little bit of background before we get to that, when we were negotiating with the local governments, it was a little bit tricky because several of them, about 35 of our local governments, had already entered into the lawsuit with outside attorneys. At the same time, our office was negotiating and suing as well. And so we had to really come together as a state to figure out how to deal with this and work together. So our core principles were and are that we would maximize any type of settlement funds. We would utilize existing infrastructure to the extent possible, to avoid duplication of services or, starting services that we already have, and then ensuring equity for all local governments. The way we did that was by really reaching out to Coloradans around the state. So you can see we did in person, we did online town halls. The AG and I in 2021 did over 18 town halls, which is really unheard of from an attorney general or a statewide elected official to really be doing that much outreach. That's how important this was to us. And so, Nate, I just forgot what your question was because I got so excited about my slides. Can you ask me your question again?
Sure. Yeah, I was just wondering if you could tell our audience what your office's current plans are for using the funds.
Great. Well, then I'm at the right slide. So what we did is we put together a memorandum of understanding with our local governments. As I said, the main thing in that MOU is basically how are we going to distribute these settlement funds around the state. So as you can see here by my diagram, 20% are going directly to local governments. We have over 300 local governments that are participating in this memorandum of understanding. And so they are all eligible to get 20% of the settlement funds. These settlement funds will come in over 18 years. And so some of the local governments have said, we're not getting enough. Maybe they have a lower population or weren't as heavily impacted as other parts of the state. So we're just going to go ahead and give that to our region. We did set up 19 regions around the state to deal with these funds. So 60% of the opioid settlement funds over 18 years will go to these 19 regions. 10% are going to go into what we're calling an infrastructure share fund share. And this is basically to really work on either augmenting existing resources that we have or adding new infrastructure. A lot of people think it's just brick and mortar, like inpatient treatment. That's not at all what we mean by infrastructure. It's anything, any type of new programming that will help abate the opioid crisis in Colorado. And then 10% is going into our office for kind of statewide initiatives. One that is really obvious to me as a statewide initiative would be our prevention and education campaign that we're putting together. These are the 19 opioid regions. So there are a lot more on the western slope than on the eastern plains. This is because of geography, right? So we'll have, if you have somebody in Montezuma County, right now the closest treatment facility might be in Mesa County or in Denver or in Pueblo. And so it became really obvious that our local governments wanted to be able to work in regions where they knew they weren't having to deal with crazy geography. There are a couple of areas like in Region 5 and Region 1 where that didn't work out perfectly, but it's still a lot better than trying to get somebody from Summit all the way to Mesa County. So that's kind of how that thought process was. And then we do have governance. I don't know if, are you ready for me to talk about how we're going to govern these funds, Nate?
Sure.
Okay, wonderful. So the governance is, we tried to keep it as easy as possible, but of course we're talking about over $500 million of settlement funds over the next 18 years and counting. So we set up a couple of different councils. So the Colorado Opioid Abatement Council, we call that COAC. They are going to oversee the 60% regional funds and the 10% infrastructure funds. So they're going to be really overseeing 70% of those funds. There were 6 local government appointees, 3 municipal, 3 county, coming from the western slope, the I-25 corridor, and the eastern plains. And then the Attorney General had 6 appointees also, but they were really more the experts. So we have 2 licensed in substance use disorder, 3 with experience in substance use disorder. So they might not be a physician or someone like that, but they might be a licensed addiction counselor, somebody in law enforcement. And then we did have 1 affected person. We wanted to make sure that the affected person's voice was at the table and just recognizing that we can't do anything without including those that have been impacted. The middle one, and apologies for the you are here, I usually show this to our Regional Opioid Abatement Council members. This is each region is going to have this ROAC set up, and this has local government, public officials, whether they're elected or appointed, and then they'll have advisory members from the treatment community. And again, most of the regions are putting affected persons on their councils as well. Then in 2019, the state legislature also put together a committee that will oversee the 10% share that goes into our office. And one thing that I think is really important for the folks here today to understand is that in order for us to maximize those settlement funds, we had to get the majority of our population, so something like 95% of our population, to sign on to these MOUs and release current and future claims against these defendants. So we started building that framework in January of 2020. And even during the pandemic, we were holding all of these town halls and doing a lot of outreach. We were able to get all but about 15 of our local governments to sign on to this MOU. And those were very, very small municipalities that were just hard to track down because, they don't have a true operating government system. So that was really quite amazing. Our state was the first one of our size to get this majority done. And we actually got 99% of our population rather than 95%. So, and we did that within the deadline. We started that in October of 2021. And by January, we had all of our signatures. So that just really talks to how much groundwork we were laying over about 18 or 19 months. So very proud of that, obviously. And I'm going to skip that one. And Nate, I'm going to turn it back to you because I think that you'll have some more questions before I get into my next slides.
Sure, sounds good. You mentioned the different regions, and we have actually, I'm going to publish a question from our audience from Sue. She was wondering if we could make that opioid or the regions, the map available, and I have that on my laptop. So I'll multitask here in a second. I'll try to drop that into the chat for anybody who would like that map. I'm remembering at the conference earlier this week that there was some conversation about kind of the differences between urban and rural communities related to the needs associated with the opioid epidemic. And what is the AG's vision on that? And does that do those different needs affect the different types of proposals that you might anticipate from those regions?
Yeah, absolutely. You know, in the metro area, we would say, you know, we probably have more resources available. We're also able to potentially put in money from our local general funds in addition to these opioid settlement funds. In the rural areas, it's a little more tricky because they already have less resources. They have less opportunities for medication-assisted treatment. They have less opportunities for inpatient treatment, and they have even less resources for recovery. And so one of the things we did was we put that infrastructure fund in place really with those rural areas in mind. We wanted to make sure that the rural areas were going to be set up for success. So a couple of the things that we did just at this conference was we talked about different strategies that are happening around the state or even around the country that might work well. One of those is we have different like medication assisted treatment vans or RVs that will, you know, go around the state and provide medication assisted treatment and behavioral health telehealth for folks in the rural area. We showed Larimer and Weld County's hub and spoke model. So this is really a model that ensures that we're treating the whole person, not just the addiction, but the whole person, like what's the root causes of this addiction. And so what I will say is that as much as we love this hub and spoke model in Larimer and Weld County, it's never going to look exactly like it does in Larimer and Weld County. Because if you were to put something like that in the San Luis Valley, it's a bigger geographical area, and again, less treatment providers. So we're going to have to really be nimble and flexible as we work through these different methods in the different regions. We did get some HICPUF, who is our Medicaid department basically for the state. HICPUF and the Office of Behavioral Health and the new Behavioral Health Administration have all said they're willing to look at the 2-year plans put together by the different regions and help them understand if there's really funding from somewhere else in the state that could pay for some of their ideas. That way they can maximize these opioid settlement funds.
Great, thank you. So I think now would be a good time to talk about maybe what these funds can be used for.
Yeah,
we talked about a range from prevention to treatment to recovery at the conference. So yeah, I think our audience would be really happy to hear that.
Wonderful. So a few things to note. Again, on our website, again, it's coag.gov/opioids. We have the map, we have the memorandum of understanding, and a whole bunch of resources there to help you as you're navigating through and figuring out kind of what we're doing. And there is the allowable uses there. We did put together some best practices that were from the Bloomberg School of Public Health, Harvard Medical School, and then as regions are thinking about how to find these other funding sources, not only will we work with HICPUF and OBH and BHA, we'll be checking out different funding opportunities as well. So one of the kind of obvious, you know, allowable uses is this idea of treatment and recovery. Treatment and recovery really go hand in hand. So somebody can go into treatment, but if they don't have recovery services afterward, this is one of the main causes for relapse. So we're trying to kind of encourage folks to be thinking of both of these treatment and recovery models. So medication-assisted treatment, you heard me talking about this earlier. This would be your methadone, your Suboxone, your Vivitrol. These are medications that will basically knock the opioid off the receptor in the brain and kind of cover it so that that craving isn't there. So medication-assisted treatment is a very, it's evidence-based, and it's a very successful treatment for folks who do have an opioid use disorder. Supportive housing and residential treatment. This is also a really important piece of the puzzle. Not everybody needs to go to recovery housing, but some folks do come from an environment that, you know, if they were to get out of treatment, go back into their environment, they may not be successful because maybe that's the environment in which they were misusing substances. So supportive housing is really important. Exploring those mental health trauma issues that are either resulting from opioid use or resulting because of opioid use. So telehealth. We also have a very big shortage of workforce in the addiction medicine space. So this is everything from licensed addiction counselors to physicians, just all across the board. We're also looking at, you know, peers. So folks who have, you know, been in recovery for some time and really want to give back to their community. That's another option. I talked about the hub and spoke models. Gender-specific care is a really important piece. Intervention. So, you know, sometimes if our physicians are trained properly, they can actually kind of spot the problem, maybe even at the pediatrician or general practitioner's office before folks lose custody of their children, right? So there's a lot of reason that intervention is important. ER personnel are a really big place where folks may come in an active overdose. And if the ER personnel act properly, they would then make sure that that person, after getting some medication in their body to kind of work on that overdose, they can get them into the resources that they need. So there's just ongoing need for training ER personnel. And also, of course, parents, teachers, trusted adults. Nonprofits and faith communities are a great place. A lot of nonprofits and faith communities actually do recovery services. The criminal justice system, this is not for the police to go out and, you know, catch the bad guys, right? This is really for the police, the district attorneys, to figure out how to get people not in jail, but into treatment. Or if, you know, somebody does need to go to jail, getting them that medication-assisted treatment while they're in jail, as well as their behavioral health services. And then when they leave jail, they're going into other resources to keep them basically sober. It's something like 125% more likely for someone to overdose after they leave incarceration because they've been sober for some time. You know, obviously their body is not, you know, used to having drugs anymore. And then if they go and use, they're much more likely to overdose. So really that continuum of care and warm handoff is really important for folks coming out of incarceration. Prevention education. We are, like I said, we're going to be doing a really big statewide campaign that local governments will be able to use and roll out in their communities. The Colorado Consortium for Prescription Drug Abuse Prevention already has been working on prescribing practices and educating physicians. Safe disposal is really important. So making sure we're disposing our medications. We have surgery, we get some Vicodin or some Percocet, making sure that doesn't stay in your medicine cabinet. So obviously any type of marketing around that strategy, and school-based programs, again, our nonprofit and faith community are really important here. Harm reduction, so obviously getting naloxone or Narcan out to as many people as we can. This is super important. We're constantly strategizing with our other state partners on how we get Narcan into everybody's hands. Syringe service programs, access to testing and treatment for HIV, Hep C. This is really a common thing to see in IV opioid users. And then there's a lot of other allowable uses. So regional planning, figuring out ways to kind of work to, like, we have 19 regions, but we would love to see some of our regions kind of working together on those larger projects. And then I think the rest of this stuff is, probably not as interesting to you all, but what I'll end with here with the slides is that what we are trying to do is, work together with our regions. They all have to turn in a 2-year plan in order to get funding. And assuming that all goes really well this first year, because this is brand new for all of us, we should have all of the regions funded by the end of this calendar year. So all very exciting. I think I will stop sharing my slides now, and we can just have a conversation.
Sounds great. Sounds great. Selfishly, I'm going to ask you about the conference on Monday and Tuesday. Did you come away from our meeting on Tuesday with the sense that we had moved the dial on prevention and communities wanting to invest in prevention as part of their approach?
Yeah, I did. And I think the other thing that was interesting was that a lot of the regions were like, oh, we're going to do all of this prevention work. And it was kind of like, well, wait, don't spend your money on that until you know what we're doing at the state level. Because again, we really want to make sure we're not duplicating efforts. And so it might be that we put together this really big campaign, but we miss a segment of the population. So for example, we don't address farmers and ranchers. We have a very large opioid use disorder that's very well hidden with our farmers and ranchers. They're very isolated, and at times that can really stem this issue for them. And so if we were not to address that, perhaps the folks who live, in the rural areas would want to develop something to go with our campaign.
Great. All right. Well, that's great. This is all really, really wonderful information. And is there, before we move to the Q&A portion of the Prevention Extension Cast, or is there anything else that you'd like to just make sure that our audience knows before we move into that phase?
Yeah, sure. I mean, I will tell you that our opioid response unit is a small but mighty team. There's 3 of us right now, and we're adding a 4th person. We're looking for somebody to manage our grants. And so once we have that person, we'll be a full team. We do operate within the Division of Community Engagement with the Attorney General's office. They just jumped right in and helped us with that conference. And that's really how we do things at the Attorney General's office. I work, like I said, very closely with the Consumer Protection Division. And it's a great office. We're all really kind of in this together and really doing great things for Colorado. So we appreciate you having me on here today and letting me talk about all this exciting work.
Great. Well, we're happy to have you here. So we have one question in the chat right now. So please, others in the audience, fire away, and I'll relay to Heidi. This first question is from the Prevention Research Center's Director of Community University Partnerships, Dave McPhee, who is also an evaluator extraordinaire. So this question is going to make a lot of sense coming from Dave. So his question is about, so there's 2 former Office of Management and Budget Directors wrote a compelling argument for the need for much more Moneyball to link expenditures to program impacts. How are the opioid settlement funds impact on public health and community functioning being evaluated?
It's a great question, and it's a little bit of a hard question right now because we're just, we haven't even sent any money out. But we have put together a dashboard that will be tracking funds as they are allocated to our regions and our local governments. And then at the back end, we're requiring reporting on what they spent the funds on. So the way the memorandum of understanding was developed was that the regions just had to give us a 2-year plan and we would send them the money. So made it really simple on the front end so that we could get this money out quickly. On the back end, there's going to be a lot more reporting. We want to know who they gave the money to, what the program was, And then we're working right now as a team, how do we track the outcomes from those, and what outcomes do we want to track, right? So currently, CDPHE is already tracking overdose deaths, number of prescriptions written, those types of things. So we're trying to figure out what isn't already being tracked, and you know, what else we want to work on for outcome data. It's complicated, and I don't think my team has the experience to do that or the bandwidth, but we will be figuring that out with our state partners and hiring someone if we need to track those outcomes.
Great, thank you. Another question just came in from Duke Rumley. Is there a list of the community relations persons for the 18 settlement commissions?
Yes, I think Duke's talking about the 19 regions. Yes, we are, now that our conference is over, we're going to start getting a lot of that stuff on our website. So when you go to our website, about the middle of the page, there is the Colorado Opioid Abatement Council webpage. You would click on that, and we'll have, once the 2-year plans are approved, we'll have those up there. We'll have the regional contacts up there, and probably lots of other things as we determine that we need to make things public. We are approaching this from a very transparent standpoint. We want to make sure that folks can access whatever's going on in their region. So the dashboard's really cool too. That's also on the website. We just unveiled that at the conference on Tuesday, so we're very excited about this dashboard and would love for you to go on and take a look. Great,
will do. Well, that, unless there's any last minute questions that pop up in the next minute or so, I just wanted to say, Heidi, thank you so much for joining us today. It's really informative and really valuable information for communities who are really trying to do right by their citizens, and really try to move the dial on this really pervasive, persistent opioid epidemic that only seems to be getting worse by the day. So I'm really hoping that, as I'm sure you are and everybody else on this call, that these opioid funds can put a dent in this epidemic. And if there's any way that the Prevention Research Center can be a good partner in this effort, we'd be happy to do that. And it's just been really great to be able to connect with you over the last week, and looking forward to continued partnership. But now that I've given my kind of end of the Prevention Extension Cast comments, we do have one more question that just popped up from Carl Hill at CU Boulder, and he is asking, what lessons have we learned from the tobacco settlements? Yeah, good question. So for example, some states actually use tobacco settlement funds to address prevention and treatment, while other states just use settlement funds to fund unrelated activities. What safeguards is Colorado being put in place to ensure that this thoughtful disbursement structure doesn't expire in 2 years and get repurposed?
I love that question. I'm so glad that you asked that. We've done a couple of things. First of all, the attorneys around the United States that worked on the settlements put this, it's actually Exhibit E in the national settlement documents. In our MOU, it's actually the Exhibit A. But these are the allowable uses. That's what you could use these funds for. These funds are not for other statewide activities like, you know, filling potholes or building bridges. This is really only for opioid abatement. Now, you can use these funds for other substances like related substance use disorder and mental health issues, but that's really what this money is for. The other thing that we did in Colorado, which not all of the states did, is we put these funds at a national administrator. So a bank in the eastern part of the, I think they're in New York. A bank in New York is going to be holding these funds. They are not going to be touching the general fund of Colorado, which is great. It really keeps those funds protected. And the only money that will go into the general fund is that 10% that's going into the AG's office. And again, we'll be reporting everything we spend money on and putting that in our dashboard. And we have really set this up so that, you know, it can withstand multiple administrations. As we know, our elected officials change over every 4 to 8 years. And so we feel like we've put a really good strategy in place to keep these funds for opioid abatement only. And I will say, you know, fentanyl obviously is one of our new opioids we're dealing with, and there's more synthetic opioids coming out, and working with you all, I think, is going to be really important in making sure that we're doing really good work in prevention so that, you know, our future generations aren't dealing with this issue as well.
Great, thanks. Thanks, Carl, for sneaking that one in right at the buzzer. So again, just want to thank Heidi very much. And you can find this Prevention Extension Cast and all of our other Prevention Extension Casts at the Prevention Research Center website. And we will also be emailing a link to this to everybody on our listserv. And until next time, I just wanted to say thank you to everybody who joined us today, and we will see you later. Have a nice weekend.
Thank you.